in support groups, we often are asked for those types of things of, what should I do? What's my next step? And while you will hear things from your fellow patients, remember, we're all individual, and exactly to your disclaimer, it is really important to work with your health team. This is hugely important, and the best thing that your support group can do for you is give you better questions to ask, and not make decisions for you, but help you understand how to frame that conversation with your provider. And, often privately and even in support groups, I'm asked for, what would you do here? And it's one of those really tough things, because I'm not you. I don't have, I'm not at your lifestyle, where you are in your life stage, what's important to you, what your options are. I don't have your chart, and I'm not a doctor. What we can do as a community is help you better understand what your choices are and what type of questions that you should be going forward with, and maybe even how to frame that conversation with your doctor. I mean, we were, right now, as we talked about going virtual, we used to meet once a month, once at the Cancer Support Community in Walnut Creek, and alternating months at UCSF. But now we meet twice a week on top of those as well, and I'll get into that logic in a second. But, yesterday it was very much of someone was having some issues, and it was, how can we help you ask better questions? How can we give you those questions that will help you make better decisions with your care team? Because really, that's what we can support you with. It's too easy to say, we are all humans. You've talked about empathy, and, we want, and I see this in the Facebook groups as well, we all want to say what we did was right, because that validates our own experience.
True.
And the hardest thing of doing any type of leadership or anything is to say, yes, that's my experience, but it may not be yours. And a lot of people who are going to tell you to do a certain thing are validating their own experience. And honestly, I learned that when I was an undergrad student, and I went to my prof to say, I have a PhD program, and I could go down the PhD road, I can go into industry, or I can get my MBA. What do you think? He said, Josh, I'm going to give you your first life lesson. Said, I like you. You're my friend. And it validates my own experience if you follow my path. And so I'm about to tell you to become a PhD student in economics and join the faculty somewhere. And I'm going to tell you that, and I need you to know that I'm only doing that because I want to see you become like me, because that validates my experience. I don't actually think you should do that, so this is your first life lesson, but it would thrill me to no end. And this is really, I've come to see this when we're online. Unless you're going to a certain doctor, you're hosed, or unless you're on this treatment in this order, you're hosed. That's just not. It's not it. A lot of us just want to make sure we're validating what we're doing. And that is really good support, is to say, here's the type of questions you need to ask. Here are some things you might consider, but really, this is your decision. This is, it's often when we ask about second and third opinions, it's like, well, what do you want to hear, and how do you want to hear it? And this is all about gaining information, but ultimately, if you're getting a second or third opinion just to have someone else make a decision for you, you've about what you need to ask so that you can make your best choice. So look, the first thing you have to do is, one, when you go to a doctor appointment, prioritize the questions you need to get answered. I write them down on a notepad so I know that they get answered. You have only a few minutes to actually ask them before things go sideways and people run on their tests and other things. On top of which, we are really crappy at retrieving information. It turns out that 24 hours after an appointment, we forget 85% of what was said, or I think it's 85 or 75. And of the stuff we remember, half of it we remember incorrectly. So part of it is taking notes. Ask your doc to have a recording, if you can record it, because these are complex topics and you may need to refer back to your notes to learn how to understand it. And really, we do this in conferences. I hope you do this in all your recordings with your docs, but if there is a time when things become doc speak or above where you're ready to comprehend, really ask them to slow down and repeat. I mean, one of the things that I do when I teach at Vail is I teach, believe it or not, I teach Microsoft Word skills. So every physician has to write what's called an informed consent, telling you what it is that's going to happen inside of a clinical trial. And honestly, a lot of them, when I see them for the first time, you would need a PhD to understand or read. And it's commonplace inside the advocacy community, but we try to get them to write at 6th to 8th grade level, to really bring it down. And in Microsoft Word, there's a way to actually do that, and I remind them to how to get that. And it's really hard. A lot of times when I'm reviewing things that are done by docs, I get them and said, this is somewhere between a brief history in time and a postdoctorate research paper. And the patient community that you're running to, 8% have advanced degrees. So the rest of us don't. And you really have to think about not the lowest common denominator, but certainly when you're writing to a huge audience, 10th grade is as high as you can take it, and really 8th grade. And you have to do that in your appointment too. If there is a term that's being used, and my wife reminds me of this inside of when I'm even doing support groups, it's like, you have to, not everyone has the same context that you have. And it is absolutely fine to ask your doc to slow down and explain something and until they get it right. So write down your question, try to record their answer, and then if it's not making sense, ask them to explain it a different way, rinse and repeat. It's back to breathing. So that's an interesting question. Tumor tissue registries. So what will be important? I was asked this by some researchers actually earlier this week, and I have a call at 3 o'clock on this later today. There's a lot of different work going on in this area, and it hasn't yielded a ton of fruit yet. But there are various net cancer registries. There's pattern.org, where those who are having surgery can certainly send their tissues so that it can be used for research. And really the role of the support group isn't for us to analyze tissue types, but more provide, much like we did in that when I was talking about the NRC, is to provide that information of what's available out there, how many places can do this, or where to go if you want to submit your tissue for research, and where to go to sign up for registries. And really, we haven't had great success with cancer registries yet, but I know that there is work underway. We do really good in this group in surveying each other to death, sending out surveys and trying, but these are points in time and they don't really give us actionable data. And I think we'll start seeing more maturity and more long perspective studies with registries or studies with patient-reported outcomes in the very near future. Stay tuned for things happening in that space. And the role of the support group really is to, when these things come around, is to help promote them and help make sure that if people are putting forth the effort to do good work, that we can support it. I think one of the roles in the NCI clinical trials, the NCI task force or steering committee, is really trying to understand whether clinical trials can recruit, and how, when we put the best clinical trials forward, how to make sure that those are, those are available to patients, and that patients understand their availability. And I think that's another area where support groups can help advance information and make sure, because the worst thing that could happen is that we have good trials that might change the dial on patient care, but we can't recruit to them because no one knows about them.